Hello everyone. In our series of Talk Plexus KOL interviews, today we have with us Dr. Srinivas Ambike. Dr. Ambike is a consultant at the Department of Nephrology at Jahangir Hospital, Pune, and has got over a decade of rich professional experience in the field of nephrology. He is also a member of many prestigious medical associations and has got several publications to his credit. He believes in promoting health awareness and following a healthy lifestyle. He has treated several patients suffering from kidney disorders in India and gives every patient the best of medical care. Thank you, Dr. Ambike, for this interview.
Welcome, thank you.
So, one of the major challenges these days in kidney transplantation is host rejection. So, can you elaborate on the recent advances in this field and how can they help in increasing the grafting procedures?
Yeah, we've been doing transplants for a while now. Earlier we had immunosuppressants which we have continued to use. There has been a major advance in the availability of drugs which we call them as induction immunosuppressants, and with the availability of higher immunosuppressants, the chances of rejection are getting lesser and lesser. Also, there have been advances in the immunological investigations that we do, tests like donor specific antibodies, panel reactive antibodies, which helps us to predict or pick up rejection earlier so that we can act earlier in time, by which we can probably prevent rejection from happening. So these advances in the form of newer drugs which are available and the immunological tests that we on a regular basis do help us in having a better life of the kidney that we transplant.
So you mentioned about the use of immunosuppressants. So don't these immunosuppressions make the patient susceptible to infection? So how can this dilemma be?
Yeah, it is a double-edged sword, as you rightly said. Here we are trying to reduce the immunity of the patient who undergoes a transplant with an intention that he does not reject that kidney. But the flip side of it is that probably predisposes him to what we call them as opportunistic infections, or he is more prone to getting infections which we normally, or which the immunity normally takes care of it. So obviously he has the risk of infection, but it is inevitable. That is the cost that we pay for the successful transplant.
Definitely, it is a double-edged sword. But immunosuppressants are often associated with side effects if they are not administered properly, as goes for all the drugs. So, what are these? Are there any specific guidelines, if any, to help decide the right medication?
Sure, very true. We need to monitor our patients with a host of tests which we regularly do. We monitor their complete blood count. They can suppress the bone marrow. So we normally do these tests on a monthly basis, so basically the dose is also titrated by doing what we call them as therapeutic drug monitoring. So we can monitor the drug levels of certain drugs by which we alter and by which we keep the drug, the dosage of the drug in the desired level. So we monitor their drug levels and accordingly we alter the drugs, the dosages.
So what are the most common infections associated with kidney transplant and how do you manage these infections?
Immediate post-transplant, quite a few of our patients do have bacterial infections in the form of urinary tract infections, which are fairly common because of the intervention because of the catheter and because of the stents that certain centers keep. So urinary tract infections, but then most of these are amenable to treatment and they usually are not life threatening always. Later on, once the acute phase is gone, then they are prone to getting viral infections like cytomegalovirus. Tuberculosis is quite common in India, so there are also incidences of patients reactivating or getting reinfection of tuberculosis which they might have had in the past. So a vigilant need is there. We need to monitor them, and we need to pick up the earliest signs so that the infection does not have deleterious effects.
So there are some complications like high blood pressure and diabetes often associated with renal transplant.
Yeah.
So what is the protocol for these complications to manage?
Apart from infections, certain drugs, the calcineurin inhibitors are notorious for these side effects which you rightly mentioned. We get what is called as new onset diabetes after transplant, and because of the drugs also blood pressure can, or patient can have hypertension. Primarily most of our patients, when they have renal failure, have hypertension, but once the kidney function sets in, quite a few of them do get off their antihypertensive medications. But because of calcineurin inhibitors, you can get hypertension. So we on their regular follow-ups, these are the tests, or monitoring them for new onset diabetes and monitoring their blood pressure is a part of the routine follow-up that they come to us with.
So Dr. Ambike, can you elaborate on the organ donor matching procedure that is done these days?
Most of, when we are talking about a transplant, let us have one thing clear. We talk about a living donor transplant, and we talk about cadaver organ donation. So in a living donor organ transplantation, it is always a related donor. So if it is a blood related donor, they have a fairly good HLA match, and that is the reason why, as far as possible, it is always a live related organ donor transplant that we promote. But unfortunately, if someone does not have a live related donor, then we go in for what is called as a diseased or a cadaver organ donation. Herein we do necessarily a lymphocyte cross match is done before we do a transplant, and the patient, by doing this test, we try to find out whether the patient has any preformed antibodies against the donor cells, in which case we don't go ahead with the transplant. This is done as a routine for all cadavers as well as live related donor transplants. And in addition to this test, we do HLA matching, the human leukocyte antigen, which denotes the presence or denotes the risk of rejection. That is done before transplant in all our live related donor transplants. So that is the way we monitor for HLA matching before the transplant.
But we have seen that most of the patients who are on dialysis are referred for kidney transplant. So in your opinion, what clinical feature marks the need for kidney transplant?
See, any patient who needs dialysis needs a transplant. And all said and done, transplant is the best option for treating patients with end-stage renal disease. So, like if it is a young individual, then we are more enthusiastic. But then now we've been having patients with beyond 60 years of age also who are getting transplanted, either a cadaver or a spousal donor transplant, and they are having a much better quality of life after transplant. So anyone who has an end-stage renal disease needs a transplant in that sense.
So now being said that kidney transplant is the need of the hour for patients who are going for dialysis. So how do you monitor a successful kidney transplant, and what are the pre-operative management factors that you take into consideration?
The patient usually gets discharged by the 7th day, during which time he has regained his kidney function, he is forming good amount of urine, and he has stabilized on his immunosuppressants. So normally most of our patients do get discharged on the 7th day. After that, in the initial few months, we need to monitor their kidney function. We need to monitor the side effects that these new drugs which would have caused him. We need to monitor their blood pressure. We need to look for any infections that, because in the immediate post-transplant period, they are on quite a high dose of immunosuppressants. So all these monitoring the patient needs, and initially we advise them to come for a follow-up at least twice a week, depending upon how well the kidney function is, during which time all these parameters are monitored.
So what are the major challenges that you face or you foresee in the next few decades in terms of kidney transplantation?
The major challenge is in the form of availability of donors. There is a big waiting list of our patients who need organs, who need kidneys, and that is primarily because they don't have a suitable family blood related donor, and the cadaver list so goes on increasing. So that is the major challenge in the form of availability of organs. Now with the with we doing ABO incompatible transplants, this to a certain extent has eased out the situation, but that is not really very great. So the major challenge is availability of donors, and chronic rejection becomes a major challenge when we start losing grafts years down the line, for which I mean, frankly speaking, antibody mediated rejection is a major challenge which would probably need to be tackled.
So what do you think are the steps that can be taken to increase the organ availability for patients requiring urgent transplant?
Public awareness is, I mean, it is coming up with the lay press, with the media, giving it a fairly wide coverage. People have now started knowing what organ donation is, how they can be of some help after their, I mean, after a brain death. So that is the spreading of awareness is the major key to have organ donation program.
So do you think an online platform of doctors like DocPlexus can help spread awareness about organ donation and organ
Definitely, if
transplantation?
you have public reach, then obviously it would help in developing a public, increasing the public awareness in the society.
Thank you so much, Dr. Ambike, for this interview.
Thank you. Most welcome. Thank you.
To stay updated on our latest scale videos and interviews, please follow us on Twitter, like us on our Facebook page, and subscribe to our YouTube channel. Happy DocPlexing!